Alright, so we're going to be talking about translational bioinformatics and how it can impact disease management. Okay, so we'll start off with what is translational bioinformatics. So it'll be pretty much developing methods that we can use to transform biomedical data and genomic data into something useful, so into proactive or predictive, preventive treatments. Okay, so two main things we want to talk about are pharmacogenetics and precision medicine. So the differences between the two. So pharmacogenetics is pretty much the study of the individual gene to drug interaction. Precision medicine will be using that information from the genome testing to personalize the medication being prescribed. Okay, so that is important because not everybody reacts the same to certain medications. One drug may not be as effective as it was expected, whereas another patient can use that same drug and have some sort of a life-threatening effect. So a good example of this, and um, with translational bioinformatics and disease management, can be seen in patients with acute coronary syndrome. So a prescription for acute coronary syndrome is clopidogrel. Clopidogrel was the second most widely prescribed prescription 10 years ago in 2007. So what we think about now is how long ago that was, and we didn't have this kind of testing. So how many people can be impacted from that drug from 10 years ago? And right now, heart disease is the #1 leading cause of death in the United States. So if we had this kind of testing back then, we might not be this high in levels of deaths from heart disease. So what happens with clopidogrel is um, studies have shown that some people who do not have a certain allele cannot metabolize the drug. So what would happen if you can't metabolize the drug is that it'll lead to adverse effects. So you can actually um, worsen your cardiovascular disease, making it worse. When you had acute, now it could be a major cardiovascular disease. So, like I said, if we're just thinking about if we had pharmacogenetics testing 10 years ago and we didn't prescribe that drug to so many people, their disease may have not worsened. So we would have the proper disease management techniques where that patient would get the testing done to see if they should be taking clopidogrel or an alternative. All right, so there is how translational bioinformatics can improve disease management.